All right, you guys, let's go. Couple laps around. Keep it going. Come on, get in line. Keep going, keep going. No messing around. Let's run, let's run. Come on, you guys, pick up the pace. Push through. Stevenson, keep running, let's go. Come on, you guys, pick up the pace, let's go. Stevenson, do you need a break? All right, go over there and take 5, all right? Okay. Now what? What's going on? AJ, can you hear me? AJ! Tiffany, go to the office, call 911 immediately. Marcy, go get the AED off the wall. AJ!
What you've just witnessed is a sudden cardiac arrest. Our victim is a teenager with an undiagnosed heart condition. Sudden cardiac arrest is not a rare occurrence. It happens to thousands of youths each year. Knowing the signs and acting in time can save lives. Administering CPR or the use of an AED can dramatically increase the victim's chances for survival. Unfortunately, in the United States, one high school age athlete dies every 4 days from sudden cardiac arrest. So let's take a look at what to do in the case of sudden cardiac arrest. This training video will also give you step-by-step instructions on what to do in the event of an emergency. You'll also be able to teach others by hosting a mock shock drill at your local school, organization, or public event. You may not know it, but you've already watched the 3 most important steps. Let's break down these 3 critical steps. Time is your enemy, so the sooner you start this process, the greater the victim's chances for survival. We advise that one person be designated as the emergency action leader. This should be the person to take charge of the situation. Usually it's the teacher or the first student who responds to the situation, but anyone can do this. The first step is check. Talk to the person. Call out their name. If there is no response and they don't appear to be breathing normally, go quickly to the next step. The next step is call. As soon as the victim is found to be non-responsive, send someone to call 911. In most cases, the best way to do this is by using a landline. If the setting is a high school or local office, make sure that the office staff is trained in what to do in this type of emergency. At the same time, the action leader should tell someone to go get the automated external defibrillator, or AED. As a part of the emergency action team, you should know where the AED is located. The AED should always be accessible and should never be locked up. While the call to 911 is being made and the AED is being retrieved, immediately begin the next step. Step 3 is care. When doing chest compressions, the average tempo is about 100 beats per minute. If it helps, you can reference the song "Stayin' Alive" by the Bee Gees. During a mock shock drill, it would be very important to tell people that chest compressions alone are just as effective as traditional CPR. There is no need to give mouth-to-mouth in this situation. While the AED is being prepped, the leader will continue CPR as clothing is removed and the pads are applied.
Apply pad to bare skin, exactly as shown in the picture.
It is very important to place the pads directly onto skin, never on clothing.
Everyone clear. Press flashing button. Shock delivered.
For the purposes of the mock shock drill, the victim comes back to life and we have a happy ending. In real life, the victim may or may not come back to consciousness. It is very important to continue CPR and follow the instructions of the AED. In every case where an AED is used to shock the heart, the victim will need medical treatment. A ride to the hospital is going to be in order. For the purposes of a mock shock drill at a public event, you will want to conclude by informing the audience of the victim's happy ending and its further need for medical attention. For the purposes of this training video, we will simply refer you to our online resource. Please visit our website for specific versions of mock shock scripts and many other helpful guidelines for leading a training session or hosting a mock shock drill. Thanks for watching.